Rahim. Today we'll talk about medication safety strategy. My name is Mansour Rashdi, medication safety officer. The key point we'll talk about what is medication safety. Next point, medication safety strategy. Next point, medication error. Next point, error outcome category. What is patient safety? Patient safety is a healthcare discipline that emerged with the evolving complexity in healthcare system and the resulting rise of the patient harm in the healthcare facilities. While the healthcare facilities is rise, so that means the error will be to the patient is event. It aims to prevent and reduce risks. So the aim of patient safety in the hospital is prevent and reduce risk or patient risk and error and harm that occurred to patient during provision of healthcare. So it's predictable to be there is events could be harm to the patient. So our rule is reduce that and that with rise when the healthcare facility is bigger. The World Health Organization, through its dissemination of patient safety solution, so World Health Organization that have safety solutions for the patient, which provided strategies. Why that is strategies? To improve the safe use of look-alike medication, single-use injection, concentrated electrolytes, sound-alike medication, reconciliation, provided guidance on strategy development in the global way. I think all we know what does mean look-alike medication. It's the same in shape, the same in the color, and different in uses or different in the strength. Like if medication will have two strength, 25 mg, and other one has 100 mg, so that we could like to look alike. Single-use injection. That's mean is pre-filled injection like enoxaparin, insulin, concentrated electrolytes like sodium 3%, like potassium chloride, and sound-alike medication reconciliations like propranolol and atenolol. That is provide guidance on the strategy development in the global way. Next point, medication safety officer. What does mean that? Develop an understanding of the specific risk with. So that is role of medication safety officer. 2. Understanding of the specific risk with high alert medication, high risk medication that use within your healthcare setting. Investigate and address the barriers to medication error reporting in your healthcare organizations. Adopt a formal performance improvement method with associated tools to use for future improvement innovation. So here I talk about associated tools. What does mean associated tools? Like we are use link of the medication error that BIOMO, which that is some of tools. Medication error form, submit to the website. So all that tools, it's used for medication error. Next point. Medication safety strategy. The first one we'll talk about high alert medications. High alert medications are most often defined as those medications that when given in error have the highest likelihood of causing harm. When given in error have the highest likelihood of causing harm. The Institute of Safe Medication Practices has published a list of medication that meet these criteria. So when we give patient high alert medication, so we have to know that medication considered as a high alert medication, and we make a sign for that is red sign label. Usually, general approach is taken for all high alert medication, such as use high alert medication labels on outside the storage containers and double checks by nurses prior to administration. In short, we have to make double check for that medication before give to the patient in nursing station. Here we have some example list of medication that meet these criteria. Selected example, high alert medication, anticoagulation medication, insulin, opioid, chemotherapy, neuromuscular blocking agent, concentrated electrolytes, medication potentially inappropriate in the elderly, medication with low therapeutic index, for example, like digoxin, heparin. So we should to have take care about that medication when given to the patient, and we have to follow the rules. Another point for medication safety strategy is high-risk medication or high-risk processes. Understanding of high-risk processes within the medication system. These are processes that warrant a proactive approach within analysis potential type of failure that could occur in the many steps that are often integral to these processes. High-risk processes or selected example of high-risk medication processes. Sterile compound. What we can call about sterile compounding? It should be in the sterile room for compounding, like IV room. And we have to follow the processes for preparing that, and should be qualified person who make that processes or who make that medications. Sterile compounding, chemotherapy compounding, infusion pump programming, preparation of pediatric medication doses, prescribing complex medication therapies, polypharmacy, management of anticoagulation therapy, management of chemotherapy. Next point, medication safety strategy, hazardous drugs. National Institute of Occupational Safety and Health, NIOSH, known to be human carcinogen and or classified by the IARC as carcinogenic or probably carcinogenic. This drug exhibit one or more of type of toxicity. We mean toxicity not only for the patient, also for ourselves as a staff that preparing that chemotherapy. So we have chemotherapy, IV room is special and separate from the normal IV room. And we should follow aseptic technique to handle with chemotherapy. Describing the NIOSH definition as of hazardous drugs, some of these drugs may present an occupational. That means occupational when you are handle with that medication, it meaning you could have amount that will be transferred in your body. So when you are using that multi-time, so we could have that increase in the occupational in your body. Hazards to male or female who are actively trying to conceive. Women who are pregnant or may become pregnant, and women who are breastfeeding because they are may present in the breast milk. So if the woman pregnant or breastfeeding, even she is a staff or even she is a patient, we could know that it will be lead to harm that mother. Medication error, what does mean that? Medication error are an important measure of medication safety. Even so we can recognize that medication error by follow medication error steps. A common understanding what define a medication error is important. NCCMERP defines medication error as NCC, National Coordinating Council for Medication Error Reporting and Prevention. A medication error is any preventable event. So we could stop with that preventable event. That means we could prevent that event by follow some step before use that medication. Preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in control of healthcare professional, patient or consumer. So the medication error could be even by or happen by professional or by patient self or by consumer. Stages of medication error. That means which stages the medication error happen. First stage is prescribing. The second stage is preparing. Third stage is dispensing. Fourth stage is transcribing. Fifth, administration. And sixth, monitoring. Type of medication error. Medication error index that classifies an error according to the severity of the outcome. So when you make analysis for outcome, we could make classifiers of the medication error. Its help to the index will help healthcare practitioners and institutions to track medication errors in a consistent systemic manner. The index considers factors such as whether the error reached to the patient and if the patient was harmed to what degree. Here we are classified by the color, how you are seeing. No error, error but, error happened but not harm, and error harm. No error, that's mean category A, circumstance or events that have the capacity to cause error. Second point, error but not harm. Note, harm is defined as temporary or permanent impairment of the physical, emotional, psychological function or structure of the body and or pain resulting therefore requiring intervention. Error happen but not harm, category P and category C. Category B, an error occurred, but the error did not reach to the patient. An error omission. Those reach the patient. But an error omission, those reach the patient. Okay. Those reach the patient, that mean the patient like to handle medication but not its use. Okay. And when the nursing area, that means the nurse preparing the dose to give to the patient but did not give. That is could be undergoing to category B. Category C, an error occurred that reached the patient but did not cause patient harm. So we have two manners. Medication reaches the patient and it's administered, finished. Medication reaches the patient but not administered. Next point, category D, an error occurred that reached the patient, required monitoring and confirmed that it resulted in no harm to the patient and or required intervention to preclude harm. Third, error harm, we have category E, category F, category G, category H. Category A, an error occurred that may have contributed to or result in temporary harm to the patient and required intervention. Category F, an error occurred that may have contributed or resulted in temporary harm to the patient and required initial or prolonged hospitalization. Category J, an error occurred that may have contributed to or resulted in permanent patient harm. Category H, an error occurred that required intervention necessary to sustain life. Last category, error death. Category I, an error occurred that may have contributed to or resulted in patient death. NCC MERP index for categorization medication error. That's all what we talk about by color, and here defined definition harm and monitoring intervention may include change in the therapy, active medical, surgical treatment. So it's like that abbreviation or summary what we are talking about. That is reference. We want to more information about. And here my contact informations. Don't be hesitate in any time if you have any question. Thank you for listening. See you next lecture, inshallah.